Welcome to the third episode of Transport Talk COVID-19. This is where we talk about a certain issue that is facing society. Every week we do a podcast and a vodcast. And you know, these are unprecedented times, as we know. And this week we're going to be talking about mental health in relation to society at large, as well as our transport community as well. I'm joined by Psychologist Jess Yap here this morning, Chief People Officer Kirsten Watson from People and Culture, and also Alan Hedevang, who is a mental health first aider. You also work at Maritime. Thank you so much for all joining us. Jess, let's start with you because you'll be able to give us a broad sort of understanding, more like obviously we know what's going on in transport. We're going to come to that in a moment and with our people. But you have a lot of clients all over the country. What are you hearing on the ground? What are the biggest issues that people are facing at the moment?
Sure. Thank you, Kate. I guess, one of the biggest issue that we are hearing now is obviously a lot of anxiety in the air. And, we all know that human behaviors, we are not adaptive to change and we do not like change. We like things to be predictable. And obviously, the current COVID-19 outbreak is creating a lot of anxiety. People are, complaining about, not having that sense of direction that they used to have. And there's a lot of changes in their lifestyle. So I guess, those are the common things I've been hearing in the last few days.
And tell us a little about your client base, because it's all sorts of people, isn't it, you're hearing this from?
Yeah, definitely all sorts of people from, all over in Australia, with different age group, and also they are all highly functional people, corporate clients. So I guess it doesn't really matter what your position is, but I guess as long as you are human beings, you are likely to respond in a way that is quite natural for us to respond to, which is anxiety and worry about the future.
Yeah. And of course, you talked about a little bit about uncertainty there and anxiety, and they're the main things we see popping up a lot at the moment, I think. In terms of how that manifests then, what are some of the symptoms you see of those sorts of conditions?
Well, I guess some of the common symptoms would be, the increased heartbeat. So people normally tell me that, they actually feel really frustrated, and there are times during the day that, they are finding themselves forget about how to breathe because the heart rate is always increasing. But there are also people, respond to stresses like this in a different way, which is, they can find themselves sleeping a bit more or not being able to sleep well and things like that, or lose of appetite. And there are also people, who would say that, they are feeling really angry and are really depressed about what's happening. So I guess, it is important to bear in mind that even though we're all human beings, but we respond to stresses in a very different way. So it depends on what's your personality and what's your nature, and also what's your surrounding environment is affecting you. So everyone has a different response.
Kirsten, you are at the front line in the policy development for COVID-19 in terms of the internal space at transport. You're hearing a lot of different things from on the ground. You have a huge workforce that's underneath you as well. What are the themes that you're seeing pop up?
I think what binds us all, as Jess has said, is that we're human. And so that fear for people that people have for their own health, their friends and their family, I think that's an absolute consistent theme. We've got a really diverse workforce. We've got people in regional areas, city areas. We've got people who are working from home, those who still need to come to work and do their frontline jobs. But that is real consistency amongst everyone. And people are having to think, therefore, about how they do their job differently. We're having to think about how we manage our homes differently. And for some of us, we're having to think about how we bring work and home together for the first time. So there's just so many new things to be going through. And having such a big part of your brain consumed with doing new things, it's distracting and frustrating. And none of us like feeling incompetent. And when we're learning new things and putting down new rhythms, it's easy to feel annoyed with yourself for not being able to do what you did before. But it's also, I think, really important to recognize this is not what we were doing before. We have to give ourselves a lot of compassion right now and give each other a lot of compassion as we work through how to do that. So people have lots of questions. People naturally want some pretty simple answers, but it's also a very complex situation that we're in, and we need to respect that as well.
Alan, coming to you now. Now, you are a unique position in that you have in the past had mental health issues yourself, so it's something you understand the mindset behind a lot of the things that drive people into these anxiety and depression. But you're also a mental health first aider, which means that you put your hand up in this organisation to help other people and to be there as a coach whenever they need it. Have you noticed an increase in phone calls, and what are the issues that you're hearing about, and what are you telling them?
Yeah, look, I take pride with wearing my mental health first aider hat within the organisation, and certainly I have been on the front line, as many of our staff currently are, and also in back offices, and I have experienced depression and anxiety, and I'm sort of aware of the kind of signs to look for. And with the mental health first aider training that we've received, it really puts us in a good position to be part of the support network that currently exists within transport. So at the moment, I'm certainly finding, even within myself, that I'm experiencing that uncertainty. And for me, I have noticed what are the sort of telltale signs. There have been some behavioural changes, some physical changes even for some people that I've noticed, and also psychological. And a lot of the time I have found with our staff that some people are able to identify this within themselves, and there are some people who can't, or are finding that this is a whole new society and world that we're currently living in, and how do I deal with this? So part of my role is to look for those signs and to approach those staff and to give support and listen and communicate with them.
And for the people that are overt, obviously that would be a lot easier for you, because people pick up a phone and they know that they're not feeling quite right, or they know that they're feeling anxious, and they'll call and they'll go, look, I'm just feeling like this. Is that the way it goes? Just break it down for us a little bit so we can understand.
Absolutely. So we certainly have a directory of all mental health first aiders available online and on the internet. And for an example, I did have one of our staffers who works in a regional office contact me, and I have common conversations with all of our staff, and it's really good to build that trust and rapport. And for me, it's not just about the workplace aspect of building those relationships, but also with my mental health first aider hat on. And in this particular instance, it was more about juggling and how to juggle the work-life balance that sort of is completely out of the norm of what that staff member was used to, and a lot of staff members right now, including myself. So what I found was it was really about talking it through and talking about a lot of the information that's coming, that I'm reading in a lot of our updates internally. And that's giving us some kind of clarity, because we go home, we watch the news, we listen to the radio, we go on social media, and it's just an influx of information and our brains are overloaded. So I do find, at least for myself, and being able to communicate that with staff, that it does give us a constant stream of a consistent message. And keeping to that is really supporting me, support our staff.
There are so many voices in this. I mean, I'm in different various WhatsApp groups, and with like a lot of people are, and Viber and all those sorts of groups, and you do get inundated with inaccuracies, like stories that are inaccurate or just scaremongering, and that has got to be playing into the psyches of a lot of people, I would think, and it's probably not necessarily helpful.
No, that's right. It's not helpful, and again, as I say, it's a whole range of staff that are feeling lots of different things, and I definitely encourage people out there to talk with their families, to talk with their friends, and really discover that they're not alone, that there are a lot of people in the same boat feeling the same way. It's really about how we manage that, and certainly there are some things that we can talk about that will assist that.
I want to touch on that, because that is a really big theme that we're probably all coming across a lot at the moment. Well, we've got people in isolation, so people working at home who are single, who are on their own day in and day out, working from home. We have people on the front line who are nervous about going to work as well. But then we also have people at home, and I'm seeing that again within friends who are parents, who are juggling jobs. And let's just break it down bit by bit. But first of all, let's talk about the parents that are at home trying to juggle their children's school curriculum as well as do a really good job. And they're putting pressure on themselves in that regard. And some of my friends certainly are at breaking point. They're finding it exceptionally difficult to manage all of it. Kirsten, what are we telling? What's the best advice we can give these people about that juggle and trying to get that balance right?
So I love the fact that we're talking about balance, and as much as none of us want to be in this situation with a pandemic, there are many things that are happening right now that I think are great conversations. We've got to find ways to keep them going, because a lot of people have had a lot of things to balance for a long time, and I wonder how we could have better supported them over time if all of our leaders had been more focused on balance and experiencing some of that. We've been working hard to bring to life our aspirational culture of what we want to achieve across transport. So what we're working towards is really putting the customer at the centre, people at the heart, and working together for the greater good. And our ways of leading help us right now in ways that we never anticipated when we developed this framework. The framework, of course, was developed with our people, by our people. And there's 5 ways that we want our leaders to be. And caring, courageous, creative, sustainable and empowering. And the care that is coming through right now is the most important thing. And I also think about being sustainable. It's quite likely we're not going to be having to juggle the things that we're juggling right now for the next only 2 or 3 or 4 weeks. We need to make it sustainable. And so one of the best ways we can do that right now is by being caring towards each other. And for people themselves to be compassionate to themselves, that self-care aspect. No one expects any human being to flick a switch and go from one way of operating to another. It's hard and we've got to work on it, and we understand that everyone will go through a transition. And I've been working really hard along with Rod Staples, our secretary, and our fabulous Chief Health Officer, Dr. Armand Castellan, to help people our leaders to get as much information as possible so that they can support their teams. And one of the most important messages that I'm focusing on at the moment is caring, for leaders to care for their team. Now is not the time to be coming down hard on someone. Now is the time to really be understanding someone's circumstances and working with their circumstances for how we can move forward.
Mm. Jess, would you agree with that from a psychology perspective?
Yeah, definitely. I think, I really like the idea of caring for each other. I think now is the time that we really want to be very patient and very kind to ourselves and other people around us. So I guess, I always like to tell my clients about this example. So when we are under stress, just imagine that we are all having a plate of fish and chips. Right. So when we actually have the, mental capacity or mental resources to deal with things ahead of us, we know that, okay, so maybe I'll have my fish and I'll have my chips and I'll have my salad. However, when we are under stress, we tend to take a blender and blend everything together and we drink it. And then we think, oh my God, that's awful. So I guess, just a really good example that, I normally bring up to my client just for them to understand. Yeah, so it is quite normal for us to have some irrational beliefs when we're under stress, all right? So it's quite a normal behavior, like what I say at the very beginning, there's a human nature. But the key is that, at this time, we want to be able to acknowledge some of the discomfort that we're experiencing. And it's not just us, and other people are experiencing this as well. So we want to be a bit more tolerant of ourselves, and we want to be kind, we want to be patient of our, just with everyone around us. We want to be caring for other people as well.
You make a really good point there, and that is that suddenly our worlds have shrunk, and people aren't moving around as much as they are. They're living in their places of residence, and they're working there, and they've got kids there, and they're getting up their daily walk or whatever it is. But suddenly your world has shrunk, and so you lose a bit of perspective sometimes on what's going on in the big picture stuff. How do we keep that in check? Like, how do you keep perspective in this time?
That's a really good point, I guess. So in a situation like that, we need to first have the awareness. Okay, so this is not what I'm thinking, in the past, maybe 6 months ago. Why am I thinking that now? So it's just a really good way to ask yourself the question. So is this a concern that I've been having, or is it just now? All right. So maybe, sometimes, just taking a few minutes just to focus on your breathing, really focus on your breathing now. And, I always tell my client that you can't forget about everything that I'm telling you, but when you are feeling really overwhelmed, the first thing you must remember is to try to breathe and bring your breathing down to, the regular breathing rate. And the next thing you want to be thinking about is you want to be checking in on your thoughts. So yes, I'm thinking about this. All right. So you want to be able to ask yourself, is this my opinion? Is this my comment on the incidents? Or is this a fact? Do I have any evidence for this? Are there any valid information that's suggesting me that my thoughts are on the right track? So if not, what's happening here? Okay, so it's really important for you to first check in on your thoughts. So we always say that we don't want to jump into conclusion, or we don't want to jump into fixing any issues without knowing where the issue is.
Yeah.
And the best way for us to go back and realize where the issue is actually to spend a bit of time, slow down, breathe, and check your thought patterns.
Which is a really good starting point. I want to talk, Kirsten, about frontline people. Sorry to jump in there, but because I know that they're experiencing quite a bit of angst at the moment. I want to make sure that they feel that we are talking about this and we are hearing them. What are you hearing from the frontline about the people that are still out there and doing their jobs every day on work sites, on our train stations, buses, etc.?
We've got amazing people on the front line across all of transport, and we've got people who are so committed to our customers and to keeping our services going. And one of the things that I hear is how sad they are not to be seeing as many customers around. For people based at stations, they do tend to get to know their customers and they miss seeing them. But there's also an immense sense of pride in terms of what they're doing. And even though we've got fewer customers that we're moving around right now, we know that they may well be health workers, teachers, emergency workers who need to be getting to where they're going. And so that sense of service that we're playing out at the moment, that's really important. Also, the important role that all of us are playing by staying away from the network is making our space much safer for the people who do need to be on the front line. And I know that they appreciate that as well.
And what are we doing? Let's move on to now what transport is offering in terms of our staff and when they do have this angst, or, even if it does develop into something even as serious as depression, or they feel depressed, or they feel flat, they're working at home, isolated, all sorts of different reasons why this could be manifesting. What are we doing for our staff, Kirsten?
So I mentioned before the work that we're doing with our leaders, and it's something that I'm asking the leaders to model is about checking in with people, both at the team level and the individual level, to make sure that we're carving out time in every day to have conversations with people that aren't about work, that it's just conversations. How are you going? What's on your mind? How are things working for you? Have a little bit of a light moment as well. We were talking about humour before and just how important that can be, just to realise that we're in a different situation, but we're still people and connecting with each other. And we're finding, what I'm hearing back is that teams that have worked together for years have found out more about each other and learnt more about each other as people over the last 2 weeks than they have in the last 2 years, which is kind of interesting, but also phenomenal. And that's one of those things I want to make sure that we create the new normal coming out of this as well. We've got lots of supports as well. Alan mentioned before, we've got information up on the Stay Informed site, and a link through from the Stay Informed site is our Stay Well Hub, and there are so many great resources there, resources from our partners like Benestar, resources that come from other authoritative sources, and it's a good place to go for the right information, both on COVID and on mental wellbeing.
And let's not shy away from some of the elephants in the room, is that tensions are heightened as well with people at home with their families 24 hours a day. The Prime Minister said it well when he said that the tensions are going to be pushed to the limits. I guess we have to be mindful of that as well, Kirsten, from an organisation. We would never like to see a rise in... We have seen anecdotally in society, well, not anecdotally, we've seen a rise in women seeking shelter from domestic violence. So I guess what's our message to our people in terms of if they do feel, they're in a position where there is tension building, or is there someone they can go internally, or they're feeling that stress themselves?
Yeah, it's such an important question, Kate, and one, again, that the entire state, nation, world is grappling with. So first of all, I would say that Transport takes a really strong position on family and domestic violence. There is no place for this in community. I understand frustrations arising from different ways of working, but there's no excuse for this behaviour. There are many avenues of support for people who find themselves in these circumstances. Of course, there's 000 in the most serious scenarios. There's also women's health shelters and different places that people can reach out to. We've got a domestic and family violence policy, which includes leave, and we would absolutely want to know how we can help people who are in these circumstances.
And of course, with this, we obviously want to have some good action points for people to walk away with. We want people to know that they're armed with the information they need to seek help if they need to. Alan, what would you tell people during this time?
Well, again, for a range of mental health issues that people can be experiencing, we're covering domestic violence, depression, anxiety, also substance abuse could be one of the things that some people are finding. Part of my role is to approach staff to gain trust with staff and to listen and to communicate with them. And it's about really making them also aware of the situation that they're in, that they're not alone often. And it's really important for me to be able to provide information to them, how they can seek professional help. Part of that is really about encouraging staff. And there are times where staff are not ready, and I need to respect that, but also need to let them know when they're ready that they can come back. And there's also an extension to that support where they can seek friends support down the line or self-help down the line, and also utilise services such as Benestar and EAP. So I would definitely be encouraging them to go down those lines. But again, it's about beginning the conversation, because a lot of the time that's part of the hardest part.
And what about the people that, as you say earlier in our conversation, there are people that won't seek help and you know there's something wrong. As an outsider colleague, how do you get them to open up?
Well, look, we're all very different. I must say I have quite a curious nature. So when I do see that something's not quite up with someone, I work extra hard to really maintain that relationship with them. And it's really about a long-term approach in some of those instances and really getting them to open up. How are you going? And they're fine. Next day, how are you going? They're fine. There'll be that day where they'll come to you and it'll be the right space and the right setting and they'll open up. I think it is human nature to get that trust and then to let a little bit out. And
what about men? Do you find is it harder to get men to open up?
Yeah, of course. I would say it would be harder overall. I'm thankful that I'm quite in touch with being able to feel that side of things with people, and certainly I find that men do tend to have a sense of pride and aren't as much in touch with their emotions. She'll be right sort of attitude. But this is not the time for a she'll be right kind of attitude. It's really about talking to your colleagues or finding that mental health first aider, or maybe those people who have thought EAP is not for me. They can certainly use the service just to call. Nobody will ever know, and it's just for themselves. And I would really encourage anyone out there who's listening to this or watching this to consider some of the things that have been said today and think about what they can do for themselves. And a lot of the first starting point for that is to talk with someone.
Kirsten, how would you like to round this off? What do you want our staff all over transport from every facet of the organisation to understand during this period of time?
Thanks, Kate. I would like them to know how much we care about them, how valuable they are to their families and friends, and we really want them to come through this well and strong, that we are here to support them as well as we're here to support our customers in the community, and we need to do both of those. And we can't, just as leaders, we can't care for others if we don't care for ourselves. We can't do what we need to do for our customers and community if we don't care for our people. So first and foremost, we're here for our people. We have lots of strategies in place, and if there's other suggestions that people would have that would be helping them at this time, I would love to hear from them.
Kirsten Watson, Chief People Officer, People and Culture. Alan Hedevang, our mental health first aider and also maritime product services manager as well. And also Jess Yap, psychologist. Thank you so much. It's an incredibly important conversation that we're having today. So I'm pretty sure that a lot of people around the entire network will appreciate your time and honesty on this issue.
Thank you. Thank you.
Thank you.